Hi friends, I am Annie, your friendly health coach. Welcome to my page. In today's video, I am going to talk about medication errors. You can follow my health and well-being on all social media platforms. How do you get your medications? Are they prescribed by a doctor or do you get them over the counter? When a doctor prescribes you a medication, do you check to see if they have prescribed the right medication based on the symptoms you described to the doctor and the possible side effects? Hold on. I'm here to address this issue to minimize these medication errors that could endanger your life and the lives of your loved ones. However, let me share some data that relate to medication errors. It is estimated that medical errors are the third leading cause of death after heart disease and cancer. According to Johns Hopkins study, more than 250,000 people die each year in the US due to the medical errors. Other reports estimate the number to be as high as 440,000. Common types of medical errors include surgical errors, diagnostic errors, medication errors, equipment failures, patient falls, hospital-acquired infections, and communication failures. But today I'm just going to focus on medication errors. Doctor and patient communication plays a significant role in healthcare. When you go to the hospital, learn to ask questions. Asking questions is the key to good communication with your doctor. If you don't ask questions, he or she may assume that you already know the answer or that you don't want any more information. When your doctor prescribes medication for your condition, make sure you know the name of the medication and understand why it has been prescribed for you. Ask the doctor to write down how often and for how long you should take the medications. Make notes about any other special instructions. If you are taking other medications, make sure your doctor knows what they are so he or she can prevent harmful drug interactions. If your doctor hasn't asked you about what other medications and supplements you are taking, please remember to inform the doctor about it. Tell the doctor if your medication does not seem to be working or if it is causing problems. For example, the doctor has prescribed a medication for you to take for 2 weeks. But when you started taking it, you started having complications. Please do not wait till the medication is finished before informing your doctor about the complications. Even if you want to stop taking the medicine, talk to your doctor first. I will give you some tips that will help you and also reduce medication errors. Tip 1. Before starting any new prescription, you must understand exactly what it is for. Sometimes patients are prescribed medications for concerns they are not familiar with. Always ask your doctor why this new medication is necessary and what it will do to improve your health. If they give you a vague answer, ask further questions to better understand the purpose of your new medicine. It's also important that you understand how your new medication works. For example, suppose your doctor says this medicine will treat poor circulation. How does it do that? Medications can work in countless ways, and understanding the unique mechanism behind your medication will help you make more informed health decisions. Another tip is ask your doctor if there are any risks associated with the medications. Another good question about prescription medication is whether there are any associated risks. You should be fully informed about side effects, adverse reactions, and other negative impacts. Too often, patients begin taking a new medicine without being fully versed on potential side effects. This makes them ill prepared for dizziness, vomiting, blurry vision, and other adverse reactions. Many medications cause more serious side effects such as blood clots or heart arrhythmia. These risks are often rare and may only occur under specific circumstances, but you should always be aware of them before taking a new medication. Always ask your doctor whether there are new serious risks associated with your new medicine and how frequently those occur in other patients who take it. If serious risks are associated with your new medication, ask your doctor what symptoms you might experience if one of these adverse effects occurs. Risks like heart attack and stroke need immediate medical attention. Make sure to ask your doctor what to do in the event one of these risks occurs. Another tip is how is this medication taken? One of the simplest yet most important prescription medication question is how the medication should be taken. Your doctor should give you detailed information on the dosage and the timing of your medication. Ask your doctor whether you should take it with food or on an empty stomach. Some medications are supposed to be taken with a full glass of water. You should also ask your doctor whether the medication can be chewed, broken, or swallowed whole, because some medications will not work as well if they are chewed or broken. Another tip is what should be avoided when taking this medication. A vital question about prescription medication is whether there is anything you need to avoid when taking it. Many medications require you to avoid alcohol consumption. Other medicines can be taken with caffeinated drinks such as coffee or tea. A wide variety of medications can be taken when operating heavy machinery, including driving a car. These things usually need to be avoided because of the medication's side effects. For example, your doctor may instruct you to avoid driving if your medication causes dizziness. To ensure your safety and the safety of those around you, always ask your medical team what you should avoid when you are taking a new medication. Other tip is how soon will it begin to work? The purpose of your new medication is to resolve a certain symptom or set of symptoms you are experiencing. Most people want to see their symptoms resolved promptly. So one of the questions to ask your doctor about new medication is how soon it will work. Some medicines begin working after the first dose, while others are cumulative and require several doses to show results. Ask your doctor how soon you can expect to see or feel results from this new medication. Their answer will give you realistic expectations about how you might feel while on this new prescription. Another tip is ask your doctor whether it will be taken short-term or indefinitely. Another one of the most important prescription medication question is how long you'll be taking it. The answer will depend on the type of medication and what it's being used for. You need to know whether you will need this medication in the short term, in the long term, or indefinitely. You should also ask whether the dosage will remain the same throughout the time you are taking this medication. Sometimes the dosage is supposed to be tapered down to a lower dose over time. Your doctor should go over all of this when you receive your new prescription. How do I take the medicine and for how long? Medicines come in many forms, including tablets and capsules, gels and creams, powders, liquids, patches. We have inhalations. We have suppositories. Some are taken once a day or once a week. Others are taken several times a day. Whatever the type of medicine, it is important to ask your doctor how and when to take it. You can also talk to a pharmacist about it. Some medicines are taken for only a short period. Others are taken for life. For example, antibiotics are usually taken for a limited time, but they need to be taken for the whole period prescribed, even if you start to feel better, to avoid the antibiotic resistance. Always check with a healthcare professional if you plan to stop taking a medicine. Suddenly stopping some medicines such as antidepressants might cause unwanted symptoms. After all the tips I have given you, when a doctor prescribed a new medication, remember to do a background check on the medication or just do a little research about the medication before starting taking them. Find out about the side effects and all the important information you want to know about the medication and see if it is related to your illness or the reason why it has been prescribed. Sometimes mistakes happen at the pharmacy. Make sure you know what medication the doctor prescribed you and what the dosage is in case the pharmacy made a mistake. Always make sure that you collect your medication from a qualified pharmacist. Always remember to consult your doctor first and don't forget to take good care of yourself. Until we meet again in the next video, thank you for watching. If you have any questions or comments, please leave them below. If you enjoy this video, if you like this video, please remember to like or follow my page and channel and share it with your friends. Thank you and see you soon. Bye.